Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Real glad that you could join us again. Going to be speaking with Dr. Eiman Shafa this morning. He's joining us here to talk about his experience with Medtronic's Midas Rex and the Mazor Robotic Guidance System. Welcome to Health Professional Radio, Dr. Eiman Shafa. Thank you so much for taking the time this morning.
Neil, thanks so much for the invite and opportunity to participate. It's a big privilege to be with you.
Now, of course, I mentioned you were going to talk about your experience with Robotic Guidance System. Give our listeners a bit of professional background. Tell us what it is that you do and where it is that you do it, and then let's talk about these technologies.
I'm an orthopedic spine surgeon. I'm a staff member at the Twin Cities Spine Center here in Minneapolis, Minnesota in the States. We've been doing this for the past 71 years, and we have a relatively large orthopedic spine surgery fellowship. We're charged to train the future of spine surgery. And my experience is, I take care of the breadth of spine pathologies, more and more focusing on less invasive, or what we refer to as minimally invasive techniques. And part of it is introduction of the robotic technology in my practice.
What is the current standard in spine surgery? Are most procedures, when it comes to the spine, invasive?
Yeah, that's a great question, Neil. We're charged with taking care of spine pathologies, and more we're refining our techniques and the way we do things. The term less invasive really just highlights our goals of delivering that care with really having the least amount of disruption, whether that is in a perioperative course, intraoperatively with less tissue dissection, or really optimizing the patient's outcomes by a tailored medical recovery protocol. But the standards of care are, it's a very interesting thing. Spine surgery is really a coming together of orthopedic spine and neurosurgical practices. And I'm really proud to be part of this, the societies that bring that knowledge base of the two practices together, and to really rapidly advance the way we deliver spine surgical solutions really across the platform. More and more, our societies are really embracing this idea around less invasive ways to deliver this care. And as we do that, we're really refining the way we understand the pathology itself, the natural history and progression of it, its prognosis, its treatments, and then obviously the outcomes of our treatments. And we're finding that, obviously the less we are disrupting natural and normal tissues in the operating setting, well, the faster the recovery for the patient really is. And the more we kind of embrace these newer and more advanced techniques, the more we are able to thoughtfully bring in technology, and that really brings us to collaborating with our engineering colleagues to really optimize the way we're performing.
Is that disruption of tissue that you mentioned, is that one of the major challenges when it comes to spinal procedures? Is the condition of the patient, the type of procedure? Are many of those challenges going to be overcome with some of this technology that we're going to be talking about this morning?
Well, surgical practices all certainly have their fair bit of its challenges, but really our charge as spine surgeons is to really deliver optimal care while working towards the way we perform these to be as most reproducible with the least chance for error as possible, right? There's multiple other perioperative challenges that we focus on, and I do think that the better that we understand the disease, that really is driven by big data, and our societies are doing an excellent job of really collecting as much information we have about diseases and their outcomes of surgery to really refine diagnoses and be really able to target surgery. And I think that's the really big challenge in spine surgery, really understanding the granular aspects of each of these particular diseases and the patients and the outcomes of these surgeries. And the more we understand that, the better We also have other charges as clinicians. We're working together to minimize narcotic needs and really minimize the amount of hospitalizations that patients need. And yeah, to your point, the less invasive techniques that we utilize will really get to the goals of less narcotics and less hospitalization and faster return to work, but also the more we're able to take in technologies that guide our surgery, the less we really need to disrupt the tissues that we don't really need to be around.
How has Medtronic addressed some of these challenges with their robotic technology?
Robotics has a lot of promise. When I first began to use robotics, really, it was the promise of being more reproducible and least likelihood of error. Right, that's the main charge for us surgeons, to be as exacting as possible. But the more that I utilize it, I realize that it's so much more than that. It's so much more than just delivering instruments to the spine. It really starts before the surgery, before I even get into the operating room. And much of that is to do with the really powerful planning software that's associated with the robotic platforms. And, that actually allows me to take a CT scan, so very high detailed sub-millimeter anatomy, and sit down before surgery, in advance of surgery, plan out exactly where I want not only instrumentation to be delivered, but look at the particulars of that unique patient's anatomy and make some surgical decisions about how to perform the surgery, whether it's our goal of improving the alignment. I can actually simulate the correction of the spine before I even step into the operating room, right? So I have this detailed plan and a certain level of confidence that we're going to be delivering exactly what I had planned, reproducibly, and to the end goals of having that excellent outcome. So I think that's really the promise of robotics, is really taking our planning, it's taking the execution and putting them together for a very reproducible outcome. To kind of go along with everything that we're talking about here. It also, I think, as I planned out more of the surgery in advance, it's really a lot off my shoulders intraoperatively. These are all decisions that we were classically making in the operating room, really making it much more inefficient and really introducing a lot more room for potential error, right?
When it comes to Medtronic's high-speed drills with the robotic guidance system, give us a little bit more detail about this recently FDA-approved technology as far as your experience is concerned.
As you know, the FDA is a really rigorous process, and the early acceptance of this marriage of these two technologies it really speaks to the importance of utilizing this. So the Midas Rex, for your listeners, essentially is a high-speed drill and burr system. The Mazor Robotics is an integration of stereotactic navigation plus a robotic guided end effector, essentially a guiding system. And putting those two together, I do believe that improves the precision of the way we're achieving our goals. Now, kind of step back from that for a second. We have the power of robotic guidance and this sub-millimeter data that we're planning along. But at the end of the day, in the operating room, where metal hits the spine is really in the guidance of the surgeon's hand. And that's, classically where we may have some inadvertent shift or change in its accuracy. So prior to the introducing of the high-speed Midas Rex drill, our cannulas or our tubular retractor systems guided through the Mazor arm were docked or placed on the spine. So that actually introduced just a little bit of potential for pushing of the patient away from the robotic system or pushing the robotic system away from the patient. And that small bit of rotation and displacement and translation really can amount to inaccuracy. So the drill, given that it's such a high speed powerful system. Now, with the navigation component, really allows us to deliver and make the bony trajectories without actually having to dock onto the spine or push the spine away from us.
Where can our listeners get some more information about this technology online?
I think the Medtronic websites do a really good job of summarizing what the technology and what the promise of the technology is, what the goals of surgery is, and incorporating not only the techniques, but the workflow solutions. So a very stepwise way that we can take each step to kind of try to eliminate as much error and make it as efficient as possible. We do a good job of surgeon training as well. So there's training courses. Much of that is recorded, and some of that can be shared with surgeons interested in this technology. And that website would be www.medtronic.com. Is that correct? That's right. Great. All right. Well, I appreciate you joining us on Professional Radio this morning, getting early and giving us this information. Hoping we'll be talking again. Neil, it was an absolute pleasure. Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.